Welcome, and welcome to this video on how you can coordinate your atrial fibrillation care, or AF, between your GP, heart specialist, and other care team members. My name's Tim Shaw. I actually have atrial fibrillation myself. When you have atrial fibrillation, you can have a lot of things you've got to manage, and your disease can come and go and change. It's really important you talk to both your GP and your specialist about that. Today, we're joined by heart specialist Dr. Clara Chow and general practitioner or GP, Dr. Michelle Crockett. So first to you, Michelle, what are the roles of the GP and cardiologist in my care?
So your GP is responsible for your overall health care. They will coordinate your care team and provide you with a health plan that includes your health issues, your goals, what actions need to be taken, and the role of other health providers that contribute to your care. You should keep your health plan up to date with any changes in your health, including your AF, and carry the plan with you at all times. Your GP will work with your team to optimise your medication and provide a referral to your cardiologist for the optimisation of your AF management.
That's right. Thanks, Michelle. Once we get a referral from the GP, we then will review the patient with atrial fibrillation. We might investigate them more for things associated with their atrial fibrillation or things that might develop into the future. And we might discuss the various treatment options, both now and into the future, such as procedures called ablation or implantation of cardiac devices.
Okay, that's great. So first of all, you see your GP first, and then your GP will refer you to a cardiologist if they think it's necessary.
That's right. But it can be difficult to try to work out whether you should be going to your GP or your cardiologist first. And this is where an AF action plan might be useful in helping lay out those decisions.
So your AF action plan is your guide to managing your AF. It can be really useful in times when your doctor is not immediately available. And because every person is different, to make the most of your action plan, your doctors will personalize it and advise you what to do in different situations. So this might include things such as what symptoms require you to seek urgent medical attention, what to do if your heart rate goes up, what medication to change, and what to do on the weekend if you'll go into AF and your GP practice is closed. So an action plan is really important because we want every person to be in control of their own health.
Yes, and it's really important to bring your action plan to every one of your appointments, including your appointments with your cardiologist, because action plans do need review and things do change. And it is a form of communication between you, your GP, and your specialist, and very helpful to keep it updated.
That's great. I've never had an action plan, I have to say, and it's certainly something I'll be completing as soon as I can. As a final comment, I wanted to ask each of you, how do you make the most of your medical appointments when you do visit your GP or your cardiologist?
It's always great to be prepared when you go to see your GP or your cardiologist, and by doing that, you will get the most out of your appointment. So, for example, it's useful to bring a list of all your medicines, both your cardiac medicines as well as all of your other medicines, and any changes in your medications. It's useful to bring any new tests or any tests that you have had over the course of the year to update your doctors. And it's also often useful to bring someone with you to the appointment, either a family member or a friend, to help listen in the appointment and maybe take notes for you.
For your GP appointment, bring a list of what you want to discuss and what you need, and make sure that your appointment time matches your needs. Another thing would be to remind your doctor to upload a health summary to your My Health record every time there's a change in your health or your medication. You could also ask for a letter from your GP or your cardiologist, summarizes any changes that are made in the appointment that you can take to your next appointments. Your AF is best managed when you and your healthcare team work together. And this can include your GP, your nurse, your cardiologist, your pharmacist, and other allied health professionals who may be involved in your care.
Great. So I guess the key message from that is that you communication is really important between your care team. So when you see your cardiologist, it's good that they'll write a letter to your GP and vice versa. I guess if you don't have a regular GP, then obviously even more important you keep records of what's happened during those appointments so you can share that. So I hope you've gained some good information today. I certainly have. And I'd like to thank Michelle and Clara for giving their advice on how to manage your care coordination between your general practitioner, cardiologist, and care team. Thank you.